Now for the next issue we should be discussing, we'll talk about what is now the Tetralogy of Fallot. Alright, so starting from Tetralogy of Fallot, Tetralogy of Fallot, from the word you get to know that tetra. So tetra is like, 4 things. So Tetralogy of Fallot, we are saying 4 things have an issue in the heart of a baby, okay, that was just born. So these are the 4 things: aorta above ventricles, that's overriding; pulmonary valve stenosis; ventricular septal defect; thickened right ventricular hypertrophy; aorta overriding; pulmonary stenosis; ventricular septal defect. Then, because there's pulmonary stenosis, the right ventricle has to do extra work to be able to pump blood into the ventricles. So there's overuse. So it's becoming big, hypertrophied. Okay? So it's just a complex heart issue. It has to do with what? 4 things are wrong. Pulmonary stenosis. So the pulmonary valve is becoming narrowed. It's not flexible again. Okay? Ventricular septal defect. So a hole between the right and left ventricles. So there's now a mixture of oxygenated blood and deoxygenated blood. Overriding aorta. Okay? Then right ventricular hypertrophy. Now, because of the thickened, or narrowing of the pulmonary valve, the right ventricle is doing much more work to overcome that resistance. Do you understand? So you're having the issue there. So clinical features: the skin is blue, test spells, hard murmurs, clubbing of the fingers and toes. Then the baby is squatting. The baby is getting tired, so they are squatting. Okay. Then poor feeding and failure to thrive. So diagnosis: do echocardiogram, chest x-rays, ECGs, pulse oximetries, just to verify that the oxygen levels are low in the body. Okay. So treatment: you do surgeries just to close the ventricular septal defect, because it is a single thing that is the most problem. You understand? Oxygenated blood and deoxygenated blood shouldn't be meeting. The relief of pulmonary stenosis, medications can be used temporarily just to manage symptoms, then long-term follow-up, okay, just to monitor for all those abnormal heartbeats and all of that. Okay, so that's it for Tetralogy of Fallot.